welcome to another coffee talk, get together, talk about stuff, whatever, with Front Office Rocks. If you haven't seen these before, we've been doing this the last couple of weeks because the dental MVP, amazing hygienists are here with me. And we know there's a lot of conversation going on in our dental community that we've been talking about in the past. If you want to see past conversations, please check our Facebook page because we've been talking for a while. But if you were here with us last week, I'm not sure if you kind of heard our conversation or maybe we had it afterwards. We've been talking a lot about front office team members, hygienists, PPEs, checking patients in, checking patients out, what the doctors prefer. And we realized we have not talked about dental assistants. And we feel that dental assistants have not been talked with enough or represented enough. So we brought our amazing dental assistant extraordinary, Tia Hunter, to the conversation. Tia, thank you for coming.
Hey. Thank you for having me. I'm glad you finally, brought us dental assistants on board. We want to have a voice.
And actually, and it's not that we weren't. It's just everybody comes from their perspective, and then we're like, what about
sure,
these
absolutely.
Right? So we caught you in the car. We appreciate you taking time. Tell us a little bit about who you are. So if anybody's not heard of you, why we're talking with you, and then we'll kind of get started on our conversation.
Well, my name is Tia Hunter. I am a dental assistant office manager in O'Fallon, Missouri, suburb of St. Louis. And I've been a professional spit sucker for 39 years now. I'm only 40, so I don't know, I was a prodigy. And that's a term of endearment. It's a talent to suck spit. Try handing that HVE to a doctor and there's going to suck something up. So I always tell people, own that. That's a gift. But I've worked in general dentistry all my career, and I absolutely love it. There isn't anything I don't love about it. And I'm fortunate enough, I get to speak to dental assistants all over the world. So I love that part of my job too.
That's awesome. And so we're all friends and we're all, met and talked and all of that kind of stuff. So Cassidy and Christina, you guys are hygienists. You guys have been out there training. You've been out talking in groups too that I've been talking about. And we said we haven't really talked a lot about assistants. So Cassidy, I'll just pick on you first. I mean, I know you're in clinic and you guys have the same issues that other people are going through. What are you seeing out there as, I don't know, the biggest concerns or how we need to come together as team members with opening up now after COVID or post, quarantine?
Yeah. So, I mean, in regards, it's really working through what are the things that are going to change and how do we now approach this as a, and I think that's a big part that we've struggled with is saying a team, but like you said at the beginning, we all tend to come from our own positions. So we see our as manager or our role as a hygienist. And a lot of times those conversations aren't being open to go with who does the temperature screenings. We've consistently been like, well, the dental assistant can do the temperature screening, right? And it's pausing to those conversations about like, okay, well, what really works best for all of us and in all aspects to making sure that the whole team is involved in the conversations.
Yep. And that's great. And Tia, so that's where we were talking about last week, where we were saying the best case scenario would be if hygienists had to see patients and had PPEs on and the front office is handling the schedule, get a floater assistant. We've said it over and over. Right. We're not saying that because we think assistants don't have the value. It's just with the way the schedule's running, it's not as tight. What are your thoughts about what you're recommending offices right now?
Absolutely. And like you guys said, everybody's got their own mojo, right? I mean, different practices, different things. But right now we're having our front desk team do it. But I've seen a lot of teams have a floater assistant take care of it. It's just whatever works for you. It's whatever, fits into your mojo for the office. And I don't think there's any wrong way. It's just, we have a sterilization tech. Many offices do. That could be, something that they do. So, it's like I said, there's no wrong way. It's just whatever works out for your particular office.
Right. And I was mentoring or talking with a client of ours the other day, and they were talking about what the doctors are comfortable to do, procedures the doctors are comfortable to do. And I'm fine with that. I think they have to have a standard of how they start bringing in procedures. Yeah. But where does the dental assistant have a voice in that? Is there, I mean, I know we give them required PPEs, but should a dental assistant be involved in discussing what they're comfortable being there with?
Well, I tell dental assistants, have a conversation with your doctor. So many times people are going on social media and they're asking questions that about their doctor that they should be talking to their doctor about. If you don't feel comfortable talking to your doctor, something's wrong with that. Talk to your doctor, tell them your concerns. A lot of dental assistants, people have health issues, right? So they have health issues. If you have asthma, if you have something like that, talk to your doctor and let them know that you definitely have concerns about that, either returning to work or different procedures that you're doing in the office. That should be a conversation that you guys have and that everybody is comfortable with, that everybody is comfortable with what you're doing. Dental assistants, this is the deal, and it's not just assistants. Our teams have to feel comfortable going back to work. We have to be confident as a team member to go back in that practice and confident and comfortable that we are doing the right thing and we're there and we're helping people, because if not, that's going to radiate to your patients. If you're confident, it's going to radiate to your patients. If you're not confident, it's going to radiate to your patients. So, we have to be confident and comfortable. So doctors, if you're listening, office managers, talk to your team members, make sure you have conversations. I think it's really sad that some of the team members that I've been talking to on social media tell me that they've not heard from their doctor or their office manager since they, closed down. That they don't know when they're going to open. They've heard things from other team members, but it's all rumors. Gosh, I hope that you've been keeping in contact with your team members, text, and we've done Zoom meetings at our office and text messages all the time and goofy things, and certainly our doctors were part of that. So if you haven't had those conversations, you need those conversations. Don't go to social media and ask about it. Talk to the people that make the difference, which is your doctor and your office managers.
Yeah, I think that's great what you just said. And Christina, I'll open it up to you for things that you've seen. But we were talking about that, about how everybody's going on social media and talking to each other and either getting advice from people who are not experts in that area, like, OSHA and HR and stuff, but then also not talking to your own doctor. So Christina, have you seen other things or conversations going on with assistants or thoughts that you'd want to kind of review with Tia?
Yeah, I think that you brought it up already, Laura, with the doctors already have their plans. Everyone is constructing these plans. And what I'm noticing on social media is that a lot of the assistants are having conversations about these plans are in place, right? Everything is set up for us to go, but nobody has had the conversation with them. Mm-hmm. And it might make sense for an assistant, when you look at the numbers and you look at the fact that we're going to be slower paced at first and we have an extra assistant, it might make sense for an assistant to be the person who's the runner, but no one's having the conversation with them. So I've seen a lot of Facebook posts about we're not the slaves of the practice. Like, why are we supposed to be the ones who clean up after everyone, grab the patients, take the temperatures, do this, do that, and no one else is picking up any of that. And I think that feeling is really cascading across Facebook. I'm just seeing it over and over again. And so I think you're already saying it, Tia, is that the conversation needs to happen. But are you seeing this from assistants as well? Are they saying that they feel like they're the workers of the practice? They're the ones being asked to do everything?
Well, I'm not sympathetic. I am, again, 39 years in this practice. And even though I am office manager, if the toilet needs clean, I'm cleaning it. And so there's part of me that's not sympathetic to that. If this is part of your job, then you need to do it. And it takes a team and it takes everybody to do it. And I realize sometimes we feel like we're being picked on and we've got the crap jobs, but we're awesome at it. We're rock stars at it. That's what we do. We are caring individuals. We didn't get in this for the fame, the fortune. So we definitely not the fortune. And so that's what we do. That's who we are. So when it needs to be done, I'm going to do it. And so I know people feel that that's not their job, but whose job is it? And I'm going to go back to the employers on that. I'm going to go back to the office managers and the employers. That should be in your job descriptions. That should be, and I realize this is, this thing threw us for a loop. I realize that, but there needs to be, everybody needs a job description, and there needs to be, those things in the job description. And now that we've gone through this and we see some extra duties that need to be done, guess what? Add that to the job description. Talk about it with your assistants. This is what we expect of you now. We're adding this to your job description. I mean, those are conversations. When we communicate together, we're gonna get rid of the animosity. We're gonna get rid of all the hurt feelings, and we're gonna have good conversations about that.